June is Cataract Awareness Month, so I want to take a few minutes to talk about cataracts and what they actually are. When we're born with a very clear crystalline lens behind the pupil in the front of our eye, and that is normal. And each decade of our life, that lens yellows. So every decade there's a little more yellowing and a little more yellowing and a little more yellowing, and someday some doctor says you have a cataract and scares you half to death. Well, that is literally the normal part of how we age. So every single one of us will develop cataracts if we live long enough. Most people find cataracts becoming part of their life in their 60s and 70s, but there's always exceptions. I've got a few patients in their 80s who are just beginning to show signs of cataract problems. I've got patients in their 40s who are showing the early signs of it. So it's not always an age-related thing, but generally it is. Things that can affect cataract development, certain medications like steroids, any kind of metabolic medication that affects your entire body can induce cataracts at a younger age. UV exposure, and now of course blue light exposure has been shown to accelerate the aging of the lens of our eyes. Diet has been shown to affect how cataracts develop. In fact, diets that are rich in antioxidants and fruits and vegetables have actually been proven to slow down the process that develops cataracts. So basically, think of cataracts as a normal part of aging, and anything that accelerates the aging of your body will develop cataracts at a younger age, and anything that kind of slows down or reduces the speed at which we age will actually help slow down how fast cataracts develop. So there's been a lot of misconceptions over the years that cataracts were a growth or a tumor, and that is just not true. So one of the things that I want to hope to debunk is that idea that it's a growth, because it's actually the natural part of our aging. Symptoms of cataracts might be, I'm just not seeing as well, I'm just not seeing as clearly, things aren't as bright, I have a lot more trouble with glare and light sensitivity. Those are symptoms that go along with the natural yellowing of the lens, and we deal with those by making lenses in eyewear filter better. We adjust lighting so that glare is less of a problem. We try to help people adjust their environment so that when they're sitting in a restaurant, they're not looking out the window, they're getting the window behind their back, and that helps to reduce the glare and improve the way they see. So those are all ways of dealing with early cataracts. When the cataracts get to a certain point where none of those things seem to be solving the problem, then we have to move forward with cataract surgery. Cataract surgery used to be a scary thing. 25 or 30 years ago, people may remember grandma having it done and having her head sandbagged in the hospital and all kinds of crazy stories. But now, cataract surgery takes about 10 to 15 minutes, and it is a very quick, a very efficient, and very successful surgery. We do all of the preparation for that here in our office, and we refer an individual to a cataract surgeon who basically that's all they do. And then we provide all the post-op after that. And the post-op care on cataract surgery today is very simple. You might be using some drops for 2 to 4 weeks, but your vision improves almost instantly after the cataract surgery is done. So for any of you out there who have fear of cataracts or have cataracts in your family, don't be too worried about it. We have great ways of dealing with it today, and please contact us if you have any questions.